You're up and about, going through your routine activities. Suddenly, you collapse without warning. Your heart stops beating, and within seconds, you stop breathing. A quick check shows there's no pulse. All signs of sudden cardiac arrest. Sudden cardiac arrest, SCA, is a condition in which the heart unexpectedly stops beating. When this happens, blood stops flowing to the brain and other vital organs. The person may die if not treated within minutes.
So the way you decide if they're having sudden cardiac arrest is, in addition to seeing if they're conscious, calling to them and seeing if there's any response, you need to feel for a pulse. So you'd feel at the neck, at the angle of the jaw, or you could listen for the heartbeat by putting your ear to the patient's chest. You need to see if they're breathing. So if they're not breathing, they have no pulse, then they're in cardiac arrest.
SCA is not to be confused with a heart attack, which happens when blood flow to the heart is blocked. However, a heart attack can lead to sudden cardiac arrest. Another way to look at it is, a heart attack is a circulation problem, while sudden cardiac arrest is an electrical one. The immediate cause of most SCAs is an abnormal heart rhythm as the electrical activities of the heart becomes chaotic and the heart is unable to pump blood to the rest of the body.
We're all at risk for sudden cardiac death, so we need to know our numbers and our status. What is your blood pressure? Do you know what your blood pressure is? Do you know what your cholesterol is? So we might be a walking time bomb and we don't know. It's not just people who appear healthy who are at risk. Somebody can be overweight and you say, oh, they're bound to drop down, but somebody who is slim can drop down as well. It just depends what the other risk factors are. So I just think the only way we can know is to know your numbers, know your status.
Among the conditions that trigger sudden cardiac arrest is coronary artery disease, a more common cause in persons over 35 years old. Also, cardiomyopathy, in which the heart muscle becomes enlarged or thick and weak, as well as inherited disorders that may cause parts of the heart to stretch and become weak. Other conditions include disorders of the heart's electrical system, as well as heart defects that were exhibited at birth. Persons who have a family history of sudden cardiac arrest or heart disease are also at risk. In contrast to elderly persons, cases of SCA is not prevalent in children.
But the children can be born with some types of heart disease that make them have a higher risk for sudden cardiac arrest. That is usually picked up if they have, sometimes at birth, because of the abnormalities. But even if they're corrected, they can still have an increased risk of sudden cardiac arrest.
Highlighted cases of SCA in student athletes in recent years prompted increased focus on evaluation for the physically active.
I would like to encourage all parents, if you have a child who is involved in any team sport, any physical activity, or even a lot of physical activity, and if they're not on a team, to please have your child checked. Carry them for sudden cardiac arrest screening. We have it at the Heart Foundation. We can come island-wide, or go to your GP and have your child tested.
A victim of sudden cardiac arrest can survive with the quick action of a bystander who is able to apply immediately cardiopulmonary resuscitation, CPR.
You will start resuscitative efforts, which would include compressing the chest in order to get the heart going. You may or may not breathe for them. Nowadays, it is not, a lot of bystanders balk at starting CPR because they don't want to put their mouth on the patient's mouth. And that's a real concern. Studies were done a couple years ago and they determined that compression-only CPR, so just pressing on the chest alone, is of value.
If available, an automated external defibrillator, AED, can be used within a few minutes to restore a normal rhythm to the heart. These may be available at certain places such as airports, stadiums, and other public and business places.
If someone has developed chest pain, they've grabbed their chest, they've sank down on the ground because they're having chest pain or they're not breathing properly, you don't start CPR for that. They need to get to medical attention immediately. But you would only start CPR if the patient is pulseless and not breathing.
Following that bit of first intervention, which must take place within the first 4 to 5 minutes of sudden cardiac arrest, the patient will need to be moved immediately to a hospital. The Ministry of Health since 1996 has been partnering with the Ministry of Local Government through the Jamaica Fire Brigade to expand its provision of pre-hospital service.
We recognize that transportation of patients to hospital is a vital part of the chain of survival. certainly from the patient suffers an incident to the point at which they reach hospital and get care. The transportation to hospital is important, and not only in terms of the time that it takes, but also in terms of the support that is provided during that transport.
You're supposed to have a defibrillator on the ambulance. You're supposed to have basic drugs which a trained paramedic would be able to administer to continue advanced cardiac life support. And when they get to the hospital, which would have been alerted from the ambulance that we're bringing in a cardiac arrest victim, the team would be waiting at the door of the hospital to receive this patient.
Based on the value of CPR in saving a life, the Ministry of Health has been partnering with the Heart Foundation of Jamaica to encourage more Jamaicans to get trained in CPR. And this important life skill is everybody's business, so get trained and be ready to lend a hand when the need arises.